653. The number may not immediately seem significant, yet it marks a real milestone for VA Maryland healthcare system. The figure refers to just how many homeless veterans they have housed this year alone. Nationally, the VA permanently housed nearly 52,000 homeless veterans. It is the largest amount in 7 years' time. And joining us now is John Clow. He is the VA Maryland Healthcare System's Homeless Program Manager. Good to see you, man.
Good to see you too.
You know, it's an impressive number. 653 means that you're able to find a place for a lot of folks who may have ended up on the street, yeah?
Absolutely, absolutely. It's
Tell
a
me
big
about
number.
that effort.
So we partner almost exclusively with the homeless programs of the VA Maryland Healthcare System. We partner a lot with our community partners, our SSVF, Supportive Service for Veterans, Families. So this year, we really put it into overdrive, and we were able to house 653 veterans between the VA and SSVF, and you know, we're excited about it, and we hope next year we're going to have more for sure.
The word that stood out in the press release you sent was life-saving and life-changing, and there's no doubt that it does that for somebody.
Oh, absolutely,
yeah,
absolutely. I mean, a lot of these folks. I mean, homeless. Well, people don't realize homeless is a much bigger. A lot of people, when they think about homelessness, they think about people actually live on the street, but it's actually a much bigger definition. So it's just not folks who live on the streets. It's folks who live in shelters, transitional housing programs, living places where they don't have a legal lease, folks who may be heading towards eviction, receive legal documentation from the court, hey, you have to be out. So a lot of these veterans are, they're homeless, so it's a much broader definition than people think.
It's also broad knowing the partnerships that it takes to make this happen. We were talking off camera that you're able to house some folks on VA property, but otherwise you're looking for property owners and landlords who are able to make this possible.
Yeah, absolutely. So our case managers and our peer supports and our housing specialists, that's a big part of what they do. They're out there looking for landlords, trying to build a Rolodex. You know, in each county, we don't, obviously we're not just here in the city, we're all over the state of Maryland. And that's one of our biggest things, is really trying to establish housing, our landlord, so that we have housing for our veterans. I mean, sometimes it's a little tough, just because there are times when the housing market just isn't great, or just the housing stock isn't the best, but we're definitely making do. It's a big effort. Sure.
Is finding housing a gateway to also finding employment as well for women and men who are in a program like this?
Absolutely. So we operate what we call under a housing first model. Okay. So that means housing first, literally. So we don't really have a criteria. So whatever your medical, mental health, substance abuse background is, you're eligible for our services. So when you come in, we believe under the housing first model that if we can house you, wrap housing services around you, you're going to be, down the road, you're going to be a lot more successful in accessing and staying in treatment and being successful. Whether it's mental health, physical health, staying on a medication regimen, making appointments. So doing that from the street's a very difficult thing to do, almost impossible.
We did a story recently. What impresses me about the VA is a sense of community among the veterans. So sure, yes, you're out in the house, or yes, you come in for medical services and that kind of thing, but as simply as playing cards in the same room, in the community room, and being able to share that shared experience. That's all. That seems like a model for
that's just the veterans. That's the camaraderie that they've had since service, and just the social aspect of it, being engaged with other folks instead of isolating at home is absolutely a big deal.
If you have a service member in your family and they're not sure about VA services, sell it to me now and why they should be checking in with Veteran Affairs.
Well, I mean, if you have a homeless family member or someone who is in danger of losing their housing, or we have what we call, and I guess we're going to put it up on the screen later. We have the VA Homeless Hotline that operates 24/7. We also have our Community Resource and Referral Center that's down on 209 West Fayette Street. So folks can just walk in, say, I'm homeless, I'm a veteran. We'll immediately plug those veterans in for services and start looking for housing.
And for them, know that stigma doesn't have to be there to walk in and say the words you just said, because there's some folks who may not want to say, hey, I'm homeless.
Absolutely.
But once they walk in that door,
they're treated as, absolutely, as soon as they come in, that there is no stigma attached to it whatsoever. Please come in, for sure. There's lots of veterans that are going through the same things that they are, dealing with a lot of the same things that they are. And they'll be obviously treated with respect and dignity.
And last thing, are there things that they should bring with them through this application process?
The best thing, if they have it, they don't have to, because a lot of homeless veterans, they don't have, that's one of the issues, that they might not have their DD-214, they might not have ID, they might not have a driver's license.
Yeah.
They may have not been enrolled in the VA mental health care system, but that's fine.
Okay.
If you don't have those things, come on down.
Come on through the door.
We'll help you get enrolled. We'll help you get all those things together. If you do, that's great.
Okay.
So again, we just require that you show up and be ready to work with us.
Love the work you do, man.
Thank you.
Good to see you.